Imagine a child who needs urgent medical care but has nowhere to turn. A refugee seeking treatment with no resources, or a student dreaming of becoming a doctor but lacking the proper guidance. CMMA is here to change that, providing care, support, and opportunities for those who need it most.
Assalamu alaikum. My name is Dr. Munavvar Izhar. I'm one of the CMMA board members and I've been associated with CMMA since the time of its inception.
My name is Dr. Muhammad Amir Shahzad. I'm a practicing internist in Oak Brook area. I have been associated with the Chicago Muslim Medical Associates since 2017.
Approximately 10 years ago, Dr. Tajammul Hussain and Dr. Ismail Shakib had a vision to bring together Muslim physicians under one platform, bound by our deen and profession.
CMMA was conceived in the corridors of Jackson Park Hospital, where we used to work. A couple of minds got together, and every year there has been an impactful thing, one after the other.
What started as a simple idea has now grown into an organization that supports
various healthcare initiatives, medical and educational initiatives, initiatives of disaster relief, charitable association with other organizations like ICNA Relief. It is also associated with MedGlobal, charity organizations.
Through collaboration and unwavering dedication, CMMA continues to make a lasting impact both locally and globally.
Locally, we have had hundreds of health fairs which have impacted hundreds and thousands of people. They provide the services on a weekly, on a bi-weekly basis, which is creating an impact.
From Pakistan to Palestine, CMMA has provided vital healthcare services to those in need.
Our overseas efforts are in terms of clinic established in Karachi in Pakistan, Hyderabad in India, Cox's Bazar in Bangladesh have had medical missions. We have had medical missions in Gaza, Palestine, Syria.
Offering consultations, IV treatments, laboratory tests, and essential medicine. Each of these clinics operate with minimal overhead.
Every single dollar was spent towards the rehabilitation of these people without even a $0 administrative cost. We are in the middle of starting up a new project in Lahore. We will be serving all the needy people who have no healthcare benefits, and they will get free medical care. We also installed 2 machines in the operating room for anesthesia for the people who have no money to get the surgeries done. And alhamdulillah, that project has gone very significantly successful in Mayo Hospital, Lahore. And inshallah, we will be doing more in that area.
CMMA has also been at the forefront of emergency relief efforts.
We raised about $300,000 for the disaster relief in Pakistan when there was a huge flood in Sindh and other parts of Pakistan. In association with Human Development Foundation and CMMA, we raised all this money and sent it to Pakistan for disaster relief, which included building new houses for the people who were displaced from their homes just because of these floods.
The situation in Gaza and Palestine is dire. Thousands of families have been torn apart. Tens of thousands of children have been orphaned. A severe food shortage has left countless people struggling to survive. With the healthcare system in ruins, medical care is scarce, and the need has never been greater. While the world debates and political decisions take time, we as Muslims must act now. CMMA has partnered with organizations working on the ground in Gaza, providing thousands of meals each day and delivering urgent medical care in makeshift tents. But this work is only possible with your support. Together, we can continue to bring aid to those who have lost everything. Psychological and behavioral health issues are affecting every family. CMMA has recognized this urgent need and established a mental health clinic providing free services to hundreds of patients.
We have started a mental and behavioral health clinic and facility that is on the premises of a spiritual place, a mosque, Masjid Isa. So it's a phenomenal location. The need is tremendous. In this day and age, psychological issues, mental and behavioral health issues are profound. They are affecting everybody. They are affecting all families. It is leading to divorce, strife, day-to-day hampering in the relationships, in the dealings, which is not good for psyche, which is not good for interaction, which is not good for progress. So with that aim in mind, we started this facility. It is currently working and functioning. We have had tremendous response. People love it. Hundreds of people have benefited from it. We want to take it to next level. We want to start providing in-service provisions of services in the area that we have. We have about 25 to 30 psychiatrists, counselors, psychoanalysis going on, sessions, counseling. We would love you to get involved in this, to help us by way of donating your time, or you could donate financially, give sadaqah, zakat. This is eligible for people who cannot afford, so we would love to have your support. We also want to advance this to a medical facility, providing general medical care.
With your continued support, we can expand these services, breaking barriers to mental health care in our communities.
Please remember us in your prayers, make dua for us, make dua for our success, and so that we can help empowering the community, our people, with the tools that they need to help resolve situations, to deal with day-to-day conflicts, to have a lesser effect on their psyche so that they can be more productive members of the community.
In the last few years, CMMA has contributed over $1 million toward medical aid, disaster relief, and community programs. When earthquakes devastated communities around the world, CMMA provided nearly $200,000 in emergency relief. During catastrophic floods, CMMA took swift action, raising over $120,000 to rebuild homes and provide life-saving aid. Through our partnerships, CMMA has contributed more than $125,000 in disaster relief, humanitarian assistance, and medical aid, helping those affected by war, displacement, and crisis. To address food scarcity, we have distributed close to $100,000 in essential supplies, both locally and globally. Beyond just crisis response, CMMA is committed to building a stronger future, investing in education, community support, and accessible healthcare. CMMA played a key role in the establishment of Burhan Academy, dedicating $500,000 to build and expand educational opportunities for future generations. At Masjid Isa, another $500,000 helped construct and develop a center for faith-based learning and community guidance, ensuring that vital programs continue to serve those in need. CMMA has also provided $50,000 in direct aid to support refugee care, rehabilitation, and settlement, helping families rebuild their lives both in the United States and abroad. Recognizing the urgent need for mental health services, CMMA established a behavioral health clinic in Addison, Illinois, investing $30,000 to provide free counseling and psychiatric care for those struggling with mental and emotional challenges. And to reach underserved communities with little to no access to healthcare, CMMA has funded free clinics in Hyderabad as well as Karachi, Pakistan, allocating $30,000 to ensure these clinics provide medical consultations, lab testing, and essential treatments for those who would otherwise go without. Healthcare saves lives. Mental health support transforms futures. Disaster relief brings hope. CMMA is making a difference, but we can't do it alone.
And I can tell you one thing, that 100% of your zakat and sadaqah goes towards the cause.
Every contribution makes an impact. Your generosity isn't just a donation. It's someone's treatment, someone's relief, and someone's second chance. Join us in continuing this mission, because together we can make a lasting impact.